so that we start. And then you can close the door. So my name is Ken Odur from the Kenya Bureau of Standards. And in collaboration with the Swedish Institute for Standards, we organized this marvelous event from Monday till today. So today is going to be our last day. And we're really looking forward to a very exciting day. And therefore, without further ado, we are projecting the agenda. We are projecting the agenda. So I want to take this opportunity to invite our host, who also happens to be our boss at the Kenya Bureau of Standards, to come and welcome all the participants officially. And then thereafter, I'll take over the program. I'll be assisted by Joachim in the course of the day. So we intend to have a very interactive session. So welcome, Director. You can a clap for him as he comes.
Colleagues, it's always a pleasure to join you here again this morning. For those of us who are in the ISO TC 338 yesterday and the rest of the week, I think we've had good time discussing quite pertinent issues on menstrual products. And I think this morning we continue with the same conversation, now in a larger group, including those who are not participating in the technical committee. Therefore, on behalf of Kenya Bureau of Standards and on my own behalf as the Director for Standards Development and Trade at the Kenya Bureau of Standards, I take this opportunity to invite all of you to this interactive workshop. We are indeed honored to have this workshop being held alongside the ISO TC 338, which means that we have so many stakeholders, both nationally, regionally, and internationally, participating in this the workshop. And it will be critical for us to discuss openly quite a number of issues that affect girls and women across the globe. Therefore, on behalf again of our Managing Director, who was not able to be here this morning, once more again, she has sent me to represent her, and she sent me with a speech to read on her behalf, which she would have loved to do it herself. But due to other duties, I'm honored to represent her here this morning. Now, without much ado, and in the interest of time, allow me to go through her speech, and then we shall officially open this workshop and proceed to the next steps. Industry leaders, colleagues from SIS, East African Community, our local technical committee experts, esteemed experts and representatives of ISO TC 338 from various countries across the globe, distinguished guests, change makers and colleagues, ladies and gentlemen. It is an honor to welcome you to this gracious seminar on menstrual products hosted under the framework of the ISO TC 338 meeting. First and foremost, I would like to extend my sincere gratitude to our co-hosts, the Swedish Institute for Standards, SIS, and they are represented here, and the entire ISO TC 338 Secretariat, including the co-secretariat from the Ghana Standards Authority, for their confidence in entrusting KEBS to facilitate this important platform for dialogue, learning, and collaborative action. I also wish to extend my appreciation to our esteemed local and international speakers, panelists, manufacturers, researchers, and advocates from civil society for joining us today. Ladies and gentlemen, menstrual health and hygiene should not be seen merely as a public health concern or issue. It is a fundamental matter of human rights, social justice, environmental sustainability, and economic opportunity. Tragically, millions of people around the globe are still deprived of access to safe, affordable, and effective menstrual products. Inadequate standards and Insufficient enforcement often lead to subpar products, perpetuate stigma, foster misinformation, and expose individuals to unnecessary health risks. We must come together to address these challenges, forge stronger standards, and advocate for equitable access to menstrual health resources for all. Together, we can make a powerful impact that will transform lives and change millions of people and uplift communities. As the national standards body, Kenya Bureau of Standards is at the forefront of a transformative movement dedicated to professionalizing, regulating, and evaluating the menstrual health sector. Our technical committees, specifically Technical Committee number 69 on medical and hygienic test products, as well as Technical Committee number 136 on hospital devices, tools, and equipment, are passionately engaged in promoting robust national and regional standards that ensure consumer safety and product quality. We also play a pivotal role in the African Organization for Standardization, which is the continental standardization body, by developing and advocating for high standards in menstrual products, safeguarding the well-being of consumers across the continent. Our mission, therefore, encompasses harmonizing national and regional standards, facilitating the seamless adoption of international benchmarks, and championing the development of African standards. Therefore, through the African Regional Organization for Standardization, I'll continue. Therefore, through the African Regional Organization for Harmonization, the Kenya Bureau of Standards, together with the other stakeholders, promote the exchange of expertise and the knowledge and foster training initiatives in standardization activities related to menstrual hygiene management. Coming closer home, and within the East African community, we are committed to enhancing the quality and safety of menstrual products across the region. We rigorously develop and enforce standards for sanitary towels, ensuring that they meet stringent requirements and prioritize user safety. This comprehensive approach encompasses establishing product specification, testing methodologies, and acceptable additives. These collaborative efforts are designed to create common standards that not only facilitate trade, but also ensure equitable access to safe menstrual products, and as I mentioned earlier on, also affordable products. Yet we recognize that our work must go further. We must first of all advance standards that are inclusive of reusable, biodegradable, and locally appropriate options to meet diverse needs, drive innovation that responds proactively to climate realities, and endorses circular economy models. And we must also prioritize the voices and expertise of grassroots innovators, small and medium enterprises and users, especially in raw resource setting, ensuring that they are not just consolidated, but fully integrated into the standardization process. And I'm glad throughout the week, we have some exhibitors who have been exhibiting some of their products. And as we go along, we need to pull all of them together towards proper standardization and ensure that the products are safe and also affordable. This seminar, we have quite a number of topics that will be covered, and it brings together an exceptional array of experts, medical professionals, researchers, grassroots innovators, and international development leaders, demonstrating the vital multidisciplinary approach necessary for fostering enduring change in menstrual health. To our esteemed international guests, thank you for making the journey to Nairobi, Kenya. I did invite quite a number of you during the ISOTC meeting yesterday. And today, I once more again thank all of you for being here to participate in this particular seminar. If you do not get a chance, take your time to explore our magnificent wildlife, Kenya's breathtaking scenery, and the extensive cultural heritage. To our dedicated local stakeholders, your relentless commitment to advancing the menstrual health agenda is truly commendable. And to the inspiring youth advocates, policymakers that are all gathered here today, may you ignite a passion to challenge the status quo and drive transformation. As we embark on the dialogue this morning, let this gathering serve not just as a moment in time, but as a significant milestone, a springboard for deepened collaboration, adaptive standards, and tangible impact in the real world. Ladies and gentlemen, as I conclude, I call upon all of you to engage wholeheartedly, share your valuable insights, and extend your collaboration beyond the confines of this seminar. Let us pledge to convert our discussions into decisive, actionable steps that will propel meaningful advancement in menstrual health and hygiene. Once more again, I take this opportunity to welcome all of you and also wish you a very successful seminar as we interact on quite a number of topics that have been lined up in the rest of the day. And with those remarks, it is now my singular honor and duty to officially declare this seminar open. Thank you very much.
Thank you so much. Another better clap for the director as he sits down. Thank you so much. So once again, I want to take this opportunity to welcome you very much to Kenya. I know most of the delegates have been with us here from Monday till today. And as the director said, we hope that you'll be extending your stay beyond today so that you can further explore Kenya and even beyond Nairobi. So at this juncture, I just wanted to quickly highlight what we've planned for today. And as you can see from the projection, we have a day that we intend will be very interactive. I know from Monday to Thursday, we've been having more of serious meetings where they have been more formal. But today we hope that we get to interact, try as much as possible to be in a table with somebody you've never seen. I don't want to see a case where people from the same country are sitting together. Try to interact with somebody. We'll be having a quiz session in the course of the day just to see whether you've learned maybe something new in a different language. So try to be ready for that. So at this point, I just want to highlight that as part of our program today, we have a number of exciting presentations on different topics touching on menstrual health and standards for the same. Apart from the presentations, we're also going to have panel discussions comprising of different experts, some local and some from outside the country. Some experts will also be joining us online. They were not able to be with us today, but nevertheless, we've made arrangements for them to join us online and participate. We've not forgotten about our audience. Also, we are going to have an interactive session with the audience where we hope you guys are going to ask us as many questions as possible, but also seek clarifications on areas where you feel like we need to clarify more. So I just want to say that this topic is very, very important for us. And it's not just about the standards, but also the local impact this could have on our societies. In the course of the day, we're also having some of our local manufacturers exhibiting their products out there, but also some international experts also came with their products. So during the break times, please feel free to interact with them, ask them questions, look at their products, and look at ways in which we can be able to you can be able to collaborate with them. I'm very sure that this is just the beginning of a very exciting journey in terms of coming up with these particular standards on menstrual products. So at this point, I want to welcome our first speaker for the day, and that is Wendy Anderson. Please a round of applause for Wendy as she comes to the stage.
Thank you very much. It's a pleasure to be here today. And I'd like a big round of applause to KEBS for hosting us in such beautiful locations in a beautiful city of Nairobi. So thank you very much. So I'm Wendy Anderson. I've had the honor to step in as chair for the ISO TC 338 Secretariat at the plenary meeting here in Kenya this week. I'm also an investor and a philanthropist, and I co-founded an organization that focuses on women's health. It's called The Case for Her. And over the past 15 years, we've been systematically investing and granting funds across the menstrual health ecosystem. We've worked in research, infrastructure, tools, distribution, products, all of these places where our entrepreneurs have been using their innovation and innovative skills to change the way the world views menstruation. Most recently, we've been investing or granting funds in standards, granting funds to the Swedish Institute for Standards to be the global secretariat for menstrual health. What I've come to really understand, this is probably the most innovative idea of entrepreneurship I've seen. We are changing a system by working within a global system. And as a result, we have an opportunity to reach scale for menstrual health in a way that we would not have seen in any of the other projects that we've invested in to date. So I'm extremely proud and thankful for all of you who donate your time, who work on this project, because you are making an incredible opportunity for menstruators across the world. So across the globe, okay, so I'll start this way. ISO standards are internationally agreed upon guidelines developed by experts to ensure quality, safety, and efficiencies across all industries. Across the globe, 170 countries have collectively created about 26,000 standards. Thanks to this, we have standards that ensure our safety in the concrete in the roads we walk on, in the quality of the air that we breathe, or even in the glasses that you're currently drinking from. But we lack global standards for menstrual products. In the past few years, some national bodies have developed their own standards, but there are no global product standards for menstrual products. Menstrual products are used by more than half of the world's population for a week every month for decades of their lives. The products are manufactured, shipped, distributed, sold, used, and disposed of with no international regulation on what they contain or insurance to the consumer that they perform as stated on the packaging. Menstrual products are also out of reach for vast portions of the world's population. Lack of globally recognized product standards is one of the most significant barriers for menstrual product innovation to enter markets in low and middle income countries. Innovations that can radically reduce cost are out of reach for more than 600 million women who lack the resources to buy commercially available options on the market today. And the absence of safety requirements across product categories forms a significant risk to women's health. The development of global ISO standards for menstrual products is underway, as you know, led by the Swedish Institute for Standards as a secretariat in collaboration with over 50 countries and with the support of funders such as the Sanitation Hygiene Fund, Capital M Initiative, and the Gates Foundation. The scope of the project is big. We are working to create standards for all menstrual products, covering all products intended both for internal and external use, and for both single and reusable, regardless of material. And we're being very careful to leave room for innovation and new products. The first standard is intended for release in about a year. It will address safety and fit for purpose asbestos. These standards will increase the quality of products and ensure the safety of its users, while in low and middle income countries, it will remove a critical barrier to market entry for innovations that will increase the variety, availability, accessibility, affordability for women and girls in lower incomes. The standards should also provide clear and comparable information to consumers. It should raise awareness about menstrual health as a critical component of health and well-being, gender equality, access to education. In fact, I consider it to be the red thread that connects most of the Sustainable Development Goals. It should also provide significant benefits to government by facilitating smoother international trade through implementation of policies that will promote economic growth. We're actively starting to work now on the rollout plan to ensure widespread adoption. We're looking for more national bodies and experts to join us now and be part of this development. So I'm asking everybody to please consider joining up if you haven't already in this critical work. It's an incredibly exciting chance to change something that looks small, but it has really big impact. So thank you very much and enjoy the day.
Thank you so much, Wendy. So Wendy has touched on some very important points. And as we've been here from Monday, we noticed that different countries are at different levels in terms of standards for menstrual products. That the goal is to try and ensure that we have an international standard that can be used across board. And in the course of the week, we've seen very interesting discussions that until we felt we needed even more time, maybe 2 weeks for this meeting, because we are seeing a lot of exciting ideas. And yesterday I was sharing with the team that normally, especially in low-income countries, we only come to adopt standards once they have been finalized. But right now in this menstrual product space, we have a chance to participate from the early stages so that our feedback, our input can also be taken care of. And once we come up with the standards, we are sure they are going to also serve our interests. And apart from just the issue of trade, of course, the issue of quality is very important for us and the issue of safety. So we hope that we are going to work together to towards that. So we're going to the next presentation. And please, if you have questions, you can put them somewhere and then we'll have a session for Q&A. But if there is a very burning issue after a particular presentation, we'll give a chance to 1 or 2 people, both online and in the room, so that they can be able to ask. So we are going to the next presenter, who is called Dr. Simon Kigondo. Dr. Simon Kigondo is currently the chair of KEBS TC 69, the TC that deals with medical textiles, where we are discussing standards on menstrual products, and it actually mirrors to the ISO TC 338. Dr. Kigondo has been very instrumental in ensuring that as Kenya, we were able to come up with some standards for menstrual products. So I want you to assist me in welcoming Dr. Kigondo as he comes to make the presentation. So a round of applause to Daktari as he comes. And he'll be touching on a topic on a bit of policy in Africa, a perspective from the medical field. This is always a very funny, very exciting field because you get to interact with the doctors, you get to interact with the manufacturers and all that. So welcome, Doctor.
Good morning. Yeah, for those who haven't been to Kenya, habari gani? I hope you've learned a bit of Swahili. My name is Dr. Simon Kigondu. I'm an obstetrician gynecologist. And the chairperson of TC 069 of the Kenya Bureau of Standards. And yeah, I'm also the president of all doctors in the country, Kenya Medical Association. I also chair the obstetric and gynecology central branch. So I sit in the gynecologist council. Wendy Anderson, thank you very much for that presentation. And I think the first people you need to support is my technical committee. It's actually the people you have been looking for. So I think my technical people who are seated there will need to look for her and immediately enroll us into the work that you're doing. Congratulations, and thank you very much. You're doing a very good job. So from a Kenyan perspective, the conversation around menstrual health has moved from silence to slow but tangible action. Over the past decade or so, we recognize that menstruation is a health, education, gender, and dignity issue. Once you frame it like that, then you start getting solutions for that. It's not just a private matter of women and girls to manage alone. Kenya was actually the first African country to make significant policy moves. In 2017, we passed the Basic Education Amendment Act, making it mandatory for the government to provide free, sufficient, and quality sanitary towels to schoolgirls who would otherwise miss school. We also required schools to provide proper sanitation facilities. This was a huge step forward, and it is acknowledged something that is critical: period poverty. The lack of access of menstrual products and hygienic facilities, that is a key barrier to the education of girls. Beyond education, Menstrual Hygiene Management Policy 2019 to 2030 was launched. I suspect one of the drivers of this policy was deliberations at my committee, TC 69. It aimed to build a holistic framework for menstrual health, one that touches on all aspects that we have said here: education, water and sanitation, infrastructure, healthcare, and public awareness in Kenya. In fact, it became one of the first African countries to actually have such a dedicated policy. However, challenges remain. Despite the free pads being distributed, access remains uneven, especially in rural, marginalized, and refugee communities. Many girls still rely on makeshift materials, compromising their health and dignity. Further, menstrual health is not yet fully mainstreamed across all government sectors. It remains heavily siloed within education and health ministries, rather than being treated as a broader human rights and an economic issue. When we zoom out and look at Africa as a whole, we see Kenya's journey mirrored elsewhere. Countries like Uganda and South Africa have initiated the free sanitary product programs. Usually these countries just copy Kenya. You know, everyone in Africa sees what has Kenya done, they copy. Zimbabwe launched a free menstrual health program in 2020. But across the continent, many countries still lack clear policies, and taboos and stigma continues to block open discussions in these other countries. So welcome to Kenya. It is a country that leads in policies about implementation. Sorry. Okay. So, yeah, okay. From a Kenyan viewpoint, we can suggest several ways that African countries can move forward. The first, menstrual health must be recognized not only in health policies, but also in education, labor, social protection, and housing policy. Secondly, we must invest in local manufacturing of affordable, eco-friendly menstrual products that support not just health, but also local economies. Third, men and boys must be part of the conversation. Usually we have seen that the boy child has been left behind with all the normalizing menstruation as a fact of life will break down the shame and empower girls to thrive. Finally, data and research must guide us. Without clear numbers on period poverty, we are trying to fix a problem we cannot measure. Yeah. So it's time to move from token programs to systemic change. It's time to listen to the voices of girls and women themselves. And it's time to build Africa where no girl misses school and no woman is shamed and no one is left behind simply because of natural biological processes. Spoken like a gynecologist. Good. Yeah, clap. I'll touch a bit on the Kenya's menstrual hygiene management policy 2019-2030. Lucorio, I can speak on your behalf, right? I'm speaking like government now, you know. The vision of it is that a Kenya where menstruation is recognized as a natural process and managed safely with dignity by all women, girls, and people who menstruate. The goal is to ensure that all women and girls in Kenya can manage menstruation hygienically and with dignity, free from stigma and barriers. The policy focuses on 6 main objectives. One is to improve access. The other one is to strengthen education and awareness. The other one is to ensure access of adequate water and sanitation and facilitate schools in that. Integrate menstrual health in national health and education systems to promote research, innovation, and data collection, and to address stigma and taboo. The key strategic areas that the policy covers are the health sector, training health workers and menstrual disorders and menstrual hygiene management. The education sector, incorporating menstrual health education into school curriculum for both boys and girls. Boys don't know anything about menstruation. Water and sanitation sector, ensuring that all institutions have menstrual-friendly toilets, for instance, which have privacy, water, and things like that. And finance and trade sector, supporting local production and innovation of affordable menstrual products, including incentives for local manufacturers. Yeah. And social protection factor, targeting vulnerable groups such as girls in informal settlements and people with disabilities and street families. The cross-cutting themes are gender equality, human rights-based approach, inclusivity, environmental sustainability, multi-sectoral partnerships. That is, there are many things we can talk about, but just in view of time, I'll jump that. So in short, the policy is not just about free pads. The policy is a comprehensive rights-based strategy to ensure that menstrual health is part of Kenya's education, health, infrastructure, and social protection agenda. So the work of Kenya is to ensure that you don't not only just have a policy, make sure your government implements it. So we need to see whether in the Finance Act 2025, some money has been set aside to manage these menstrual issues. Then just a short mention about Kenya Medical Association and menstrual health policies. We advocate for menstrual health and health as a human rights issue. Kenya Medical Association is the umbrella organization for all doctors. This has thematic committees, one of which deals with menstruation and other issues similar. It's the Reproductive Health Committee of Kenya. It gives technical input on menstrual hygiene management. It has conducted a lot of public education and awareness campaigns and supports research and data collection and advocates for inclusion of vulnerable populations. And finally, we participate in the KEBS TC69 on towels, medical and hygienic products. The reason I was chosen as the chair of this committee is because I'm non-aligned. It's a medical association, so it's not a manufacturer, it's not a seller, and they've refused to remove me here for the last, from 2017. I've been trying to leave, they've refused. So that is the role of the medical association, yeah. Yeah, so quickly, just to go through some of the challenges that KEBS has faced in menstrual hygiene products. The rapid growth, market growth, and informal products have posed a challenge to KEBS. So they have to keep seeing how to tackle these informal products, how and all. Limited technical research and local testing facilities. And here we need ISO to help us. I have sat in that committee for many years to know that Kenya needs help. One time, one of the KEBS secretary put me in an American Standards Association meeting, and I say that Kenya needs a bit of help in some of these technical issues. And we are happy the Swedish have come in to help us on this issue. Low public awareness and enforcement challenges. All these are, of course, financing issues, and balancing affordability and safety. It's a big issue. Stakeholder coordination. Our committee has many stakeholders, and from the dynamics of the committee, you can already see some of the issues that face coordination or on discussing some of the issues, and resistance from some private sector players. We won't go into that. That's political. My last point on parts in terms of menstrual health standards. Over the last years that we've been having technical committee meetings, one of the biggest challenges we faced, and I remember one of the standards that we had a problem, not a problem with, and actually may have led to the formation of the menstrual policy of Kenya, was to try to standardize reusable cloth pads. The biggest debate was, what is a standard? And from induction into the committee, a standard is something that is repeatable. Yeah. The problem with reusable cloth pads is that the environment in which the pads has been faced is different. You might be using a pad in Turkana where it's 45 degrees centigrade, and therefore you use it and dry it at 45 degrees centigrade. But the other people in Nyeri, where the Mount Kenya area, where the temperature is 0 degrees centigrade, you have dried the pad. But if someone comes and complains, and you have put standards and said that you should have dried the pad at 45 degrees, it's difficult to really standardize. And one of the recommendations that came out of the committee is that the Ministry of Health should actually, standards and policies should be matched so that you do not have a fight about standards. One of the biggest issues they were having with lack of standards of reusable cloth pads is, what criterion do you use for trade? How do you sell it? How do you say this reusable cloth pad is of standard? You see, and if someone complains, how do you say that? We'll tell you, no, you're in Turkana. That place is too hot. That's not the environment to make these pads. So that was a very nice thing that came out that eventually I think has been discussed over the last 2 days, I'm sure. And our issue on standardization needed to be taken into consideration. But we are happy the Ministry of Health took up the issue, made a policy on the same, and I'm very happy. So on behalf of my team, I have my KEBS. Can you stand up, my team? There's a very good debating club. There, KEBS TC69. These are the ones who make the standards on stand up. Even the next presenter is from my committee. Yeah, you need to see them. Thank you very much. That's the support we need. And that's...
Thank you so much, Dr. Kigundu. Maybe just to quickly just highlight a few issues that Daktari and our chairman of T69 has raised. I think one thing that stood out for me is the aspect of we cannot do these things alone. Maybe a standard alone is not enough. We need to also ensure that these standards are being referenced in our regulations so that there is no contradiction between the policy and the standard. I think in the course of the week, we've had interactions where we've mentioned that at times we see cases where maybe the policy sometimes is not really aligned with the standard. And therefore, we are trying as much as possible to bring all stakeholders on board. And part of what we are doing, or part of the discussions, was identifying all the stakeholders, just apart from the standards developers, who are the other stakeholders that we need to bring on board, so that even as we come up with the standard, we are sure that we are going to get the support of everyone. And the last thing also I wanted to mention from Dr. presentation is the issue of especially the reusable pads market. If I was to give an example of Kenya, I think most of the local production is around the reusable pads. Most of the disposable pads come as imports. And one of the things he was raising is that we need to build local capacity for production, but also that one doesn't mean that we need to compromise on the quality. We know that a pad is something that is very sensitive, and as is mentioned, we have a presentation in the course of the day that I expect is going to maybe try to bring a solution to that, because we're going to get a presentation from one of the manufacturers, and she's very passionate about that. So I hope that she's going to touch on that, so that we're able to see how can we solve this. Because when I speak to people from Kenya, you speak to somebody from Uganda, you find that our challenges are more or less the same. So I'm very sure when we come up with ideas, we're able to work collectively to replicate them elsewhere. So at this point, I want to twist it a bit. I know having worked at KEBS, I've not worked at KEBS for a very long time. I joined KEBS actually 3 years ago, and when I was joining KEBS, that is the time in Kenya, we were banning, Kenya was banning some items like the single-use plastic bags, the seedling potting bags made from plastic, and even the garbage collection bags. And I remember interacting with the client who had been sent to KEBS because she was coming up with a product that she was calling biodegradable. And she thought that we have standards stored somewhere in KEBS for all the products. They just come and then we give them to we give it to them. And when she came and we were interacting, I noticed that we have a lot of innovation actually in this particular space. We are seeing people coming up with products from very many different things, and I hope that is encouraged. So at this point, I want to call upon somebody who is in research. She interacts very much with people from the infancy stage. They support them in terms of turning the ideas actually into actual solutions. I want to welcome Dr. Ann Mburu from the Kenya Industrial Research and Development Institute, KIRDI. A round of applause to Ann as she comes.
Good morning, all. Morning. Is it so cold? Good morning. Yeah, thank you. My name is Doctor, but not medical doctor, but Dr. PhD, Anburu. I work with an institution by the name Kenya Industrial Research and Development Institute. Actually, we are just neighboring KEBS. And today I want to just touch on the research trends on eco-friendly development of eco-friendly materials from fibrous agro-waste materials for absorbent menstrual products making. And just like my colleague Ken has mentioned, I think we need to have a balance between the products that we make and taking care of our environment, because that is actually the way to go. So just to bring something to your attention, some background. This is a Kenyan context, and it is estimated that schoolgirls from poor backgrounds lose an average of 4 learning days in a month due to lack of sanitary pads. So consequently, some girls are forced to drop out of school, making them more vulnerable to the violation of their rights, such as early marriages and child labor. Therefore, for those who don't want to go into early marriages and they're really thirst for education, they may choose to use unhygienic materials such as torn pieces of clothes, leaves, and in a worst case scenario, depending on where they come from, they may dig a hole and they're forced to sit in that hole for the entire period of their menstruation. So these unorthodox practices therefore exposes them to soiling, infections, mental torture, and stigmatization, because of course they're not able to attend school because they'll be stigmatized. So menstruation is hence linked to girls' dignity and has a tremendous impact on their education performance in school. Just to echo what Dr. Kigondu has just said, it's not just education matter, but also the self-esteem of the learner and the academic performance. Therefore, like he mentioned, the government through the Ministry of Education provides free sanitary pads to poor schoolgirls. But according to a report by the Auditor General, the government spends about 3.1 billion from 2011 to 2022 financial years. In 2023-2024, the government allocated 940 million Kenya shillings to the program. However, this amount can only benefit about 22% of the neediest girls. So you can imagine what happens to those who are left out, yet they still need to access schools. So the Ministry of Education only provides an average of 3 packets out of the required 9 packets in a year due to the budget constraints. Therefore, there is a need to supplement the government efforts by developing quality and affordable sanitary towels from locally available resources using simplified technologies, whereby even the women in the local setup can actually use a simplified technology and actually make decent menstrual products. So in line with the sustainability, SKILD, we have done a bit of research, and from the statistics, rescue agricultural waste. Kenya is a majorly agricultural based country, so we do a lot of agriculture, and therefore, once the crops are harvested, there's a lot of agricultural waste that is left behind, which constitutes about 30%. And this can be reclaimed through value addition. So Kenya produces about 2 million tons of banana fruit, which translates to at least 8 million tons of the plant waste. That's just the banana. About the pineapples are grown mainly in the coastal, central, and eastern region. And it is estimated that about 247,000 metric tons of pineapple was grown in 2021. And this is projected to increase at a rate of 2.3%. And therefore, once the pineapple is harvested, again, you're left with a lot of waste in terms of the leaves, the crowns, and the pits. The other crop I want to highlight on is the maize, whereby after harvesting the maize, you're left with the stalks, the leaves, the combs, and the husks. And stocks can make up to 40 to 60% of the leaves, up to 30%, and comes up to 20%, and husks up to 15%. That is enormous waste on the farm. Disposal of the agro materials is mostly done through feeding the livestock, leaving them on the field to rot, or even burning the waste in open fires. The waste produces a lot of greenhouse gases that is not safe for the environment. And therefore, validation of this waste would aid in blocking the harmful gases and help in replacing the plastics and also preserving our forests. The initiative would be ideal contribution towards abating the greenhouse gases emission, of which Kenya has signed against. And therefore, use of natural fibers from agro-waste residues promotes environmental recyclability of the low cost, or even free new materials. So we just highlight the importance of the resource in form of waste that we have. So all this waste can be converted into absorbent materials that can be used into the making of the absorbent core of the sanitary pad, because they are cellulosic and hence absorbent. So besides the waste that I have highlighted, we are also doing something on use of okra. I hope you all know the okra pods for use as a binder when you're making the pulp. And we're also investigating use of starch in form of cassava, corn, into making of bioplastic for the backsheet material of the pad. So that's just a photo showing how the flow goes. So you have the maize husk, you have the banana stems, and you have the banana leaves as the raw materials. The fibers are extracted. For the maize husk, you just dry the material, and then you extract the pulp. The banana fiber, you just extract the fibers. You pulp. You could have it as a pulp as in a fluffy form, or even as a sheet for making of the ultra thin. And then for the pineapple as well, you dry and then you pulp. So in the end, you make the absorbent core for the pad. So the next steps for Kildi, that is where we are. We need to fabricate a small scale technology for the construction of the pad, because at the moment you have just done research on the extraction of the pulp from all these agro waste materials, but we are yet to come up with a machine that can actually do the construction of the raw materials into a pad. Then we need, once we construct the pad, there's need for testing and certification, and then marketing of the technology and or use of pads. Maybe just to mention at this point, at Kildi, we offer common manufacturing facilities. So as SMEs, you don't have to buy your own machine. If Kildi has the machine, you just come with your raw materials, or you could process your materials at Kildi, and then you just make your product and walk away and market your product. So in terms of a disposable pad, at Kildi, we have that machine that makes the disposable pads. Like I said, it's under common manufacturing facility, whereby SMEs come with their raw materials and make their pads at a small scale, because you realize at a commercial scale, you need very huge machines to produce at a commercial scale. So for us, we have downscaled the technology, and we have bought a small scale sanitary pad production machine that can make up to 16 pads in a minute. So those are the raw materials that the SMEs need to come with. And that is the product that's made from the machine. So the advantage of the machine, like I mentioned, it has high production capacity. That is at that scale of a small scale. We have also certified, the product has been certified by KEBS, and it's meant to empower local small scale production, and hence it will improve the health of the girls, and hence consequently increase the school attendance of the girls. So, but one challenge, we have had several challenges with this machine because at the moment, much as we are saying we need to promote local production in Kenya, and I think Mr. Ken mentioned, most of the menstrual hygiene products are imported. Yeah. And therefore you find we do not have any local manufacturers of the sanitary pad making raw materials. And therefore, because this technology is meant for you to be used by the small scale clients, they are not able to buy the materials in bulk. So that is one gap that we need to address. And therefore, again, the brands by the small scale consumers, they face stiff competition from already established brands. And therefore, and again, the technology is of high cost. And therefore, that is why, as one of the intervention, KID has positioned this technology for the SMEs use. So what are some of the interventions that can be able to solve these challenges? The SMEs could be offered loans to procure the raw materials. Therefore, there is also need to promote local manufacturing or stocking of the raw materials. And then we need to intensify R&D on cheap technologies for sanitary pad development. So I think that is what I had. And thank you for listening.
Thank you so much. Can you earn a better clap, please? Especially the SMEs in the room. Yeah, so as much as we are coming up with the standard, we're also trying to look at how do we help the SME who has an idea in terms of how they can come up with a very good product. And we are seeing an example of Kirdi supporting the SMEs. I've seen a number of them where they're able to come up with a product, and then before they even come to KEBS for certification. Instead of just dwelling on the challenges, I think that presentation was trying to offer some sort of solutions that we can work together. One key message that I think is coming out from all the presenters is that this discussion needs an approach where all of us work together. It is not something that can be left to only one person. I was telling a team here recently that there's a time we were discussing a standard, and in the room, majority of the people in the room were men, even though the standard was majorly used is a product for women, and the women were more active in the discussion. So I was saying that anything that affects a woman, of course, automatically affects men even more. So like as the presenters mentioned, I think we need to work together even in terms of research. And maybe you'll answer this later, but my concern was only on when we use the food products. My concern was on the idea of once maybe the market is very big, especially in my country, Kenya. I'm just wondering whether people now may become, they may not even allow the food, because I'm assuming that for banana, for example, they're extracting the fibers after harvesting the banana. But assuming the market is so good, I'm worried that some people may start extracting the fibers before the banana ripens, and it may also cause an issue of food security. That is just food for thought. I know we still also have other non-food items that can be used, so that is just maybe something for us to think about, and I know we can look at it later during the panel discussion. So so far all the presentations we've received are from Kenya, and at this juncture I wanted us to board a plane all the way to Asia. But before we go to Asia, I have someone who just wanted to share something in 3 minutes, because we were supposed to have a presentation from someone called Professor Mwasiagi, but unfortunately he's not here with us. So there's someone I want to give only 2 minutes as I set up the presentation, the next presentation, to just share something for 3 minutes. He's an SMA in this particular sector. He's not talking about his organization, he's talking in general on behalf of the SMEs, both locally and even in other parts of the country. So help me to welcome Rex Iringo. Rex, welcome.
Thank you so much. Thank you so much for the opportunity to be here. My name is Rex Itonga Iringo, the founder of 100 Pound Reusable Sanitary Pants. In the matters relating to reusable sanitary pants, actually, I want to thank the organizers of this event, the International Organization for the Standardization of CAPS, because by the way, we get to know and learn more on what is needed from us so that the product we give to the client and the end users, we give something of a quality and standard. Sometime when we started doing the manufacturing or armor production, we didn't have a guideline of what things we are doing. We have been facing some challenges, and I want to thank CAPS for coming in actually, because we are learning from them, and also because we are the people who go, the producer, we are the people who go to the field. We collect a lot of information, and also you can share with them, like the challenges we face when it comes to reusable sanitary pants. I wish we could have a platform whereby we can educate our people by letting them understand that the reusable sanitary pants are even more better actually, because when it comes to compare the disadvantages and advantages of them, they have more advantages than other pants, from environmental, health, and so on. If the government can look on that to help people understand there is this product and we want to push it so that at least with time we can be able to eradicate the poverty period. Another thing I would like to talk about is the producers, the people who are in the front of production. I want to challenge you, because we do them as an individual. Please, let us all come together so that we can talk in the same voice. I know you may see me as a competitor, but the whole thing is we have one objective. So we can come together and channel our way so that we can have one voice when we are speaking, and we will go far. Thank you so much.
Thank you so much, Rex. I think he's tried as much as possible not to market his company, but to speak generally on behalf of people in that sector. And like he has rightly said, I think this sector is very big. All the players who are doing something in that sector, I think all of us have the market is there. And part of the reason we are doing this is also to ensure that even as we come up with the standard for the menstrual products, we involve especially the SMEs from the onset, so that when it comes to enforcement, it will become a bit easier for us, because we expect that there'll be more buy-in because we've involved you from the infancy stage. That is why we are even having the exhibitions going on, so that the next time you see a regulator, you don't run away, but actually you run towards them and embrace them, because we're actually here to support each other. As much as I may be a regulator, but I'm also a human being. These things we're talking about here also affects me directly. So at this point, I want to welcome Mr. Peris from Sri Lanka to make a presentation. Welcome, Piri.
Which one do I use? Can I? Okay, fine, fine, fine. So thank you so much for having me present. And I think what I want to say is this is my first time in an ISO forum of this nature, although we have been working on this and it was very much the business world. We talk about competition that we can go to the third slide directly. We can go to the third slide. Or even the fourth one, just to save time. We can go to the, yeah. So I think this is what as a manufacturer, we are most times in silos, just focusing on product. But in this space, in the spirit of collaboration, I think there is an absolute need to think holistically in a collaborative multi-stakeholder ecosystem to enable access, education, and advocacy. And this is not to say as one entity you have to do all of it together, but it is to say that you have to work together with partners and stakeholders to enable all three cogs of this wheel in order to really promote and kind of alleviate the problem that we are all collectively trying to solve, which is access to menstrual product for women. So yes, as a manufacturer, maybe firstly, the focus is on safe, affordable menstrual product portfolio, which promotes choice. But at the same time, how do we work together on the menstrual hygiene and education component? So it's not just the awareness and the education, but it's also the access to health clinics via midwife, for instance, in Sri Lanka. How do we have the health clinics and the family planning associations of the world connected to the access and the product? How do we then use menstruation as a topic to talk about gender-based violence, child safety awareness? Because what we've seen in the work that we do in Sri Lanka is that menstruation equalizes women like no other topic in the world. And it creates a sense of safety to bring in topics of gender-based violence, child safety, and so on. And it's so important to have that element also coming in as we do our work. Then, of course, it's not just enough to talk to them about the gender-based violence, but the legal aid side. How do you connect the lawyers in? How do you connect the legal aid clinics in? And then what we can't forget is the climate action piece. We can talk about periods, but if we don't have a world to live in, we are not going to be menstruating here for a long time. So what we understand is that women as a core, I can even use the term here that women are responsible for a lot of waste that comes into the world, because we are the ones who can choose to segregate, we are the ones who can choose to do many things. So how do you bring the climate action agenda to a practical level to talk about how to positive environmental events? And the most important, the private sector has to be open, share,
and have open source frameworks is the monitoring, evaluation, research, and learning, which can then contribute to the standards that are being created nationally and globally. Next slide. So just a few points before I research and learning frameworks that we have created, which is open source for all the organizations working in Sri Lanka on this at the moment. We work very collaboratively. We have understood as a manufacturer and inspire other manufacturers also to extend their portfolio. So choice with safety. It's not about one pad. It's not just about disposables. It's not just about reusables. As my colleague said there, it's about a portfolio. It's about the women. It's not about us. So I think this is always something that we have to change our mindsets about. Again, menstrual hygiene and awareness, it's a critical, crucial component. But if the only access we have is to go into villages to do this, how do you democratize access? And I think here where we had a chat with Wendy the first day I was here as well. How do you digitize? But then what about the penetration of mobile devices? So a lot of things to talk about when you're looking at democratizing access to education. Again, like I said, how do we engage women in climate action? So it's not just a huge conference that happens around the world with treaties being signed, but what do you do at household level to contribute to climate action? And the innovation space. I mean, we have to have this cross function also in relation to choice, functionality versus affordability versus accessibility. So these are some of the things that are coming out very strongly from the monitoring, kind of the learning phase. The next and last slide. Okay. So how, because we can't be subjective in the learnings that we have. We need evidence, we need data. So while we as a civil society, as an org, I'm really coming from a civil society manufacturing perspective here, the way that we contribute to national and global standard making is absolutely with evidence. So as organizations, when we are on the ground, when we are donating, when we are working with women, we have to have a robust MERL strategy and a framework behind the work that we do. It cannot be about beautiful stories or heart-wrenching experiences. I come from a social enterprise background with 35 years of experience. We have to move beyond the woman, the pictures, the videos. We have to move beyond. It has to be data-driven. It has to be evidence-based. So it's very, very important as organizations on the ground that we invest in MERL and we really share the frameworks and methods that we use. And that's the way we contribute to national and global standard making. Tanya, thank you so much. Terminology matters so much, and it has to come from a practical perspective as well. So thank you for having those voices in the room. LMIC views, contextualizing, even at national level. How do we enable civil society, especially those on the ground, to contribute to to contribute to standard making? How do you bring that interaction in? Continued consultations, maybe focus groups. There's so many methods around the world that can be used, but it requires also standard bodies to go out of their way to engage, right? Globally and from a very ground up level. From a manufacturer perspective, facilitating SME supply chains, very important, but striking a balance with safety. How do we take those next steps as standards open up and the space, especially for reusables, open up? How do you balance SME innovation with safety? And then finally, consumer trust, product acceptance. What's the role of health ministries, health promotion bureaus in that education and awareness? So maybe to go back to where I started, this journey cannot be made alone, and I'm not just doing an emotional pitch here, but it needs a mindset shift to think collaboratively. Manufacturers have to open their minds. It's not just about competition. It's not about product placement. It's not about market share. Yes, you have to, be sustainable as organizations, but there has to be a shared learning approach. No law, no standard can dictate that to us. That is a mindset shift that we need to have as organizations to do this. So yeah, we look forward to sharing, learning, continued engagement with all stakeholders. Thank you very much for having me here.
Thank you so much, Paris. And I think, like Paris says, I think it's not just a matter of talking here and then it stops. I'm hoping we are going to continue these conversations. We're going to continue these interactions. And from this seminar, we intend to come up with very critical points that we can continue discussions nationally with a view again to coming back internationally. So far, are you enjoying the presentations or they are boring? They are good? Yeah, so we want to have one presentation before we take a short break. And the next presentation actually for me is very important, especially from the background of somebody speaking from an LMIC low medium and income country, because I know we have different challenges in our countries, social differences, economic differences, and therefore we want to get to go through a presentation that we'll try to see how can we ensure that we bring all the voices of all the places together so that they are all represented in our standards and even in policies. So at this point, I want to welcome and please join me with a round of applause as we welcome Ms. Madhi Dalal, founder of PadMad.
Good morning, everyone, and thank you for sharing this platform. I'm going to speak today a little bit about what we are doing in Kenya, and this is PadMad. Just for your information, we believe in menstrual health solutions, but also mainly protecting dignity, building confidence, and strengthening health. So here we are. And before I begin, I really want to thank KEBS, especially for giving us all this platform. It has been an incredible week. SIS, and of course, ISO, for all these dialogues. Some have been frustrating, some have been very inclusive and knowledgeable. So thank you so much. On a personal level, also, it has been a great place for wisdom. And here I wanted to just tell you a little bit about who I am. My name is Madhi Dalal. By profession, I'm a pharmacist. I'm a yoga instructor. I'm a dancer. I also have a textile background. I'm on the round table for the Welsh government for period policy. But in Kenya, I'm running a social enterprise called PadMad. I'm not going to dwell too much on this because you've already heard. And thank you from the representatives from KEBS for really grasping this in a quite a conclusive way. What period poverty is, you know, apparently in so many statistics, 65% of the girls and women in Kenya cannot afford sanitary pads. 1 million girls are missing school every year. And for me, also more importantly, the plastic pollution, 500 to 800 years for disposable plastic pads being decomposed is another issue that we're trying to solve. I think Ms. Anne has touched upon this, what girls and women are using in this country, so I won't dwell upon that in the interest of time. From my experience, really, it has been a bit of a journey. I have a story about how I started this, from being a pharmacist to being here in Kenya and doing what I'm doing. But more importantly, I wanted to share that menstrual health has so many knock-on effects. You know, if you can manage with dignity, you can actually have equity in your school, in your workplace, etc. So not only are we trying to bring in products, which is actually one thing that we do, more importantly, we're trying to bring in awareness, We're trying to bring and really include boys in our conversations, talking about taboos and stigmas and cultural norms. So that has sort of taken us on a different journey than what we started. We also believe a lot in partnership. Including organizations who work with water solutions. And so I'm going to spend a little bit of time here. It's a bit complicated, but I wanted to share a little bit about the model that is working for us here. And I really hope that this co-creation can, with other countries and other contexts can help. Education, environment, and empowerment. So with education, like I said, we go into school settings or rural, urban settings. We go into urban settings or rural settings, talking to boys, community members, chiefs, teachers, trying to bring in menstrual health education, but also working with the stigmas. Including this, we also train trainers who are more culturally appropriate in areas where, demographics, obviously, like we heard, matter. Dr. Simon was talking about demographics, how Nyeri is different to Turkana. So we include that in our education. And our other part, which is environment, we are part of a circular economy here, working with UNICEF's Environment Hub. And we are also part of a organization who are helping bring our own organization to become as carbon friendly as possible. Our products are biodegradable, except we use plastic buttons. And we are also working with the textile companies very closely here to make sure that their waste is used properly within our own products. The product is long lasting, therefore much more affordable, etc. The other part of this conversation is the women who, and also some men in our programs who are making these pads. We are engaging different partners. So for example, ex-incarcerated women, teen moms, etc., really empowering these population who would otherwise not be able to secure a formal job. So we're trying to bring this into this context also and help them with a mentorship also in financial backgrounds. As you know, we also work with on a program called MHM in the workplace, where we go into factory settings, check the sanitation, etc., and then advise the hierarchy depending on where we are on how to help the women be more efficient within their company's setting, but also to make sure that they are empowered and efficient. I think yesterday, one of our colleagues, Ms. Prada, was talking about people, planet, and prosperity. That's the kind of model we've been working for. We have a full vertical. So with our partners, the cotton is being grown in Kenya. Hundreds of women are employed there. From the time it's harvested to our product is only 6 weeks. And then we go into the setting of education, workshops, training of trainers. And then we are also bringing in the product and following through with surveys, which I think Selena was talking about, data-driven, evidence-driven products and packages. This is our key product. This is our key place that we are actually now focusing on. So making sure that we're getting all this data and then translating it into our own product, but into the whole context of menstrual health. So this is some of the scale of impact. We work with the SDGs quite a lot. And Wendy Anderson was speaking earlier about how awareness, how we're working with the environment, how we're bringing in creating jobs, especially in this country, and how we're bringing in gender equity. Okay, so as we've been speaking the whole week about co-creation being the buzzword, I really do want to thank KEBS, especially for, being the leader, especially in Africa, on standardization, the fact that this is so necessary, it's so important, it's so pertinent that we speak about it and openly and on a global scale. So I do want to represent not just our company, but just generally in Kenya. It's a progressive country on menstrual health, and we're learning from each other. I think I'll skip this for now because, like one of our colleagues said just earlier, that reusable really, in my own belief, my context is that it is the way forward for many reasons, economic being one, environmental being another huge one, health, etc. I want to share, if I may, because I have been told there's not too much time. So I'll leave a little bit of space after this for Q&A if there is time, but I want to share, if I may. I wanted to share a video about what we do currently. Oh, there. And this is just one partner we've been partnering. It's a little bit of an old clip. Should be. It's an old clip, but it just gives you context of how things work in Kenya. No? I think. Sorry. Yeah. Okay. Okay, maybe we can play it a bit later. So now that we have some time, if there's any questions and answers, which you would like me to bring in some clarity. I have 3 minutes. We have some challenges though, and I think I could maybe have some time to speak about that right now. Basically, there's many myths. So for example, we're in a setting where, and I think we've experienced it this week, what if there's scarce water? What if there's not enough water? What if, how do we ensure hygiene practices, etc.? And those we are trying to combat conversation after conversation, constructively with the government, but also with the stakeholders. But I would like to say in this context, really, there are so many advantages. There is, we found reducing cramps. There's a lot of reducing in waste in places like urban slums. If you go to Kibera, for example, they're called flying pads, disposable pads, which, there is really no formal way of disposing. So when they are soiled, they chuck them over the shoulder and it lands on somebody's doorstep. So things like that, we're really trying to avoid. We're lessening teen pregnancies. We have a whole data sheet about that, just teen pregnancies. And above all, I really do feel it's dignity versus dependency. There's another trend, which you may not know. In Kenya, and perhaps in other contexts also, there's something called transactional sex, for where girls are going into sex for pads. So we really do feel that this is a sustainable solution, which is long lasting and also economical. Then our call to action really is, let's collaborate. I cannot say more what Selina has said and echoed everyone else in this room. We really need co-creation, different contexts, and let's collaborate and let's keep this dialogue going, because I think it's very pertinent that we do so right now. And we, as PADMAD, as Kenya, we call for partnerships. We're always very open. So yeah, that's it for us for now. Maybe if the video plays later, we can try. But otherwise, do I have time for questions? Okay, we'll try the video after the break.
Thank you so much, Madhvi, for that very great presentation. I think when you look at the program, it's a bit packed. We wanted to go all the day up to evening, but some of our delegates will be traveling back today. That is why we had to compress the program. Otherwise, I think we are really giving the presenters very little time and maybe not better engagement. But we hope that some of these questions will be answered in the afternoon when we have panel discussion, and later then we have Q&A. So if you have any burning questions, don't feel shy to raise them. Those joining online, we're also looking at the questions you're raising. There's someone responding to them. So don't think we've forgotten about you. I think we have around 60 people joining us online, and we appreciate. Kindly continue sharing the link with your network so that we can have as many people as possible joining us. So at this point, I want us to take a quick break of 15 minutes. So it's 10:30 East African time. So I request that we kindly be seated by 10:45. We have tea and coffee outside there. When you exit the hall, you go to the right. So let's break for 15 minutes and then we convene at 10:45 for the next session. Thank you. So let's come back to the hall. Let's come back to the hall. Sorry for the slight delay. The online team, we are starting in a minute's time. Deborah, assist me in telling people to come into the hall. Please come into the hall. Please just get in with your tea or snacks. Kindly, we are resuming. So let's set EAC TC on textiles, which actually covers menstrual products. So kindly help me welcome Levi Kanene. I'm told in Uganda they call him Levi, not Levi. In Kenya we pronounce it as Levi. So Levi will give us a perspective from the East African region. Welcome.
Thank you, Ken. Good morning. Okay, that is what I'm handling. I'm delighted to be here. So as Ken has introduced me, I'm the secretary for that TC, which is currently handling menstrual products. This is what we're going to look at. When we speak about the ESC, what are the partner states in the ESC? Then the framework for standardization in the ESC and the like. Okay, the East African community is made up of 8 partner states. I know in ISO they are referred to as member bodies, but then in East African community, these are partner states. Those are the 8. The original 3 members were Kenya, Tanzania, and Uganda, but we keep growing. And in terms of the population of the East African community, it is 331.1 million citizens. So the standards that we are developing are to cater for that kind of population. So when we come to the ESC, now one thing I know is that ISO produces standards that are voluntary in nature. And different regional standardization bodies have different mandates. When it comes to the ESC, the standards that are produced have to be enforced in East Africa. And this comes from the legal framework for standardization under the East African Treaty. So in the East African Treaty, it exhibits the highest level of commitment to standardization. We have Article 81 in that treaty, which provides for standardization, quality assurance. There are provisions. If a member chooses to say that we are joining the East African community, I'll give an example of Somalia, which has just recently joined. Assuming Somalia did not have a national standards body, by joining the East African community, automatically Somalia has to establish a national standards body. Right now, I know that the DRC does not have a national standards body, but because it is part of the ESC, it's mandatory that they come up with a national standards body. And so every member in the East African community has to abide by this SQMT Act. So we have a council which approves standards, a council of ministers. We have the East African Standards Committee, which monitors the development of these standards. I know that ISO, we have the TMB, but here we have the East African Standards Committee, which sets up other committees that guide the development of the standard. And then there are also provisions for the adoption of declared East African standards. For instance, once we develop an East African standard, every partner state has to withdraw the national standard that is similar to the existing regional standard. So the countries are given 6 months to withdraw national standards. That's how the ESC works. And even in that space, in case as ESC, we say that we are adopting the ISO standard that we are developing right now, it implies that we have to go back home and withdraw the existing national standards. That is the implication of the ESA treaty. And lastly, all partner states are required to participate in standardization activities. It's not a matter of, well, I can choose to participate or not. It's mandatory. You have to participate. Unlike ASO, I know we missed the presentation of the African Regional Standardization Organization, but then in ASO, it's voluntary. You can choose to participate or not. You can choose to adopt the standard or not. In ESC, as long as you signed the treaty, you have to participate. Benefits of harmonized standards. Now, of course, standards benefit each and everyone, but specifically, I'll speak about technical regulations. As I've said already in the ESC treaty, we have to take on the standards. The beauty about harmonization is that it facilitates movement across borders. And then in the ESC treaty, we recognize the quality marks that are issued by the different partner states. If KEBS issues a quality mark on a sanitary product, then in Uganda, we do not have to take it to the laboratory to carry out more tests. Why? We recognize what KEBS has done. So that is provided for in the treaty. So now coming to the East African region, we have different menstrual hygiene standards. Here I did a case study. As I've explained, some countries have just joined the East African community and work is just beginning. But I picked out these 4 who have been in the community for some longer time. In Kenya, we have 3 standards that are applicable to menstruation. We have the disposable sanitary towel, which is a harmonized standard. And then we have the reusable sanitary towels as a national standard. It's not harmonized. And then we have the standard for disposable panty liners. In Rwanda, we have only one standard. It is the harmonized one. The beauty about the harmonized standard, it's working across East Africa. But then from this, you can see that different partner states have either chosen to move on to develop national standards for these particular products or not. So in Rwanda, we have one, and Tanzania, we have one. Then in Uganda, we have 96, 2018. Now, slightly about the years, the current publication is 2024, but some countries are yet to adopt that. In Uganda, we've had a national challenge that we have a National Standards Council, which is meant to approve standards. And this was dissolved last year. We've not yet got a new one. Otherwise, would also be with the updated version of 2024. So we have that for disposable, then 1782 is for the reusable sanitary towels. But we also have a standard for reusable menstrual cups and then a standard for tampons. So why the differences? Now, as I mentioned that we recognize that the harmonization of standards implies that we are all agreeing to this, and it could become a technical regulation in East Africa. So we don't just develop standards and say, okay, maybe some people are interested, some are not. If someone is not, then we have to listen to their voice. Now, because disposable sanitary towels are accepted everywhere, there are no issues, we have a harmonized standard. When it comes to the reusable sanitary towels, many of us have mentioned that they are distributed, especially in the low income settings, the areas, they're widely distributed. However, when it came to the East African region, some partner states had concerns which had to be respected. Some spoke of cultural settings that are, well, this product, how do we wash blood? Because in one or the other standard, the standards also encourage the product to be taken out to the market. If there is no standard, then some people are usually skeptical. They are not sure about the safety of the product. So when we develop a standard, then that is an assurance to the consumers that yes, this is safe. So some people have reasons that are well, cultural practices. They do not embrace these reusables, but also what happens during use, risks of infection. The talk we are having today, that what Dr. Simon spoke about, the way someone handles the pad in one area with plenty of water is different from where there is no plenty of water. Then lastly, standards are demand driven. Why you can see that in different countries, they have standards for menstrual cups, tampons, and whatever. It's because there was demand. In some countries, there is no demand. And whereas the standards body may think that this is prudent and crucial for the community, as long as the society has not demanded for it, you can't develop that standard. So moving on, as I conclude, I'll just want to share an overview of the harmonized East African standard on disposable sanitary towels. I know that in ISO, we have a structure that we are coming up with, but maybe this could also, in one or the other, throw more light on how, as East Africa, we came up with the structure of our standard. So these are the clauses we have. Yes, that is the scope. Clause 4.2, these are general requirements. General, not so much tested. They could be subjective, but visual inspection. But those are the general ones. And then we have the performance requirements, including absorbance capacity, absorbance rate, pH, moisture content dimensions, then microbiological requirements, and then the like. So briefly about the general requirements, we speak about the absorbent filler, how it should be, and I've seen some of these in the proposed ISO draft. Then these are some of those parameters which I believe China will be looking at in whatever they're proposing. So as ESC, we looked at absorbance capacity, that they should not leak. And of course, there is that test method. We looked at absorbance rate, that if blood, if someone menstruates, how soon should this flow be absorbed? So we have that absorbance rate. pH, Elizabeth mentioned about, different discussions on pH. But as East Africa, we looked at, in the edition of 2018, we had 6.0 as the pH. But then when we were discussing, we looked at the pH of the skin biologically. And then we looked at the pH of the vaginal fluid during, menstruation. And we looked at also the pH in Ocotex 100 for textiles which come in contact with the skin. And so we came up with that requirement of 4.0 to 8.5, looking at those factors. Why I'm speaking about pH, maybe it could also help us to conclude on things of microbiological requirements, that we look at what are the total viable bacterial counts in the vaginal flora during menstruation. Because sometimes we want to set very high limits, and yet the reality is you bring maybe a sterile product in a place which has about 100,000 CFU per gram. But those are just thoughts and ideas which keep coming as we discuss. So we have that kind of discussion, and I've already mentioned about the total viable bacterial count. And in the last days, a number of people expressed some of the concerns on that. So with that, thank you. Asante sana. Thank you.
Thank you so much, Levi. As we set up for the next presenter, I think I just want to highlight 3 key things from Levi's presentation. And one of them for me is he spoke about the issue of the time given for us to, once we have a standard, what time do we give for the different players, especially the SMEs, to adhere to the standard? I know we'll have a case where we have those who are currently in the market. We have those that intend to join this diverse market. So I think that is a very critical consideration, and I think it may also form part of our panel discussion to see maybe what other countries that have already implemented some of these standards have done in terms of ensuring that they take care of all the segments of the market, that is the medium, small, and the large manufacturers. How do they ensure that they're given ample time to adhere to the standard? I know if I was to speak on the example of Kenya, we need to work with the different players. The standard is so stringent for them. Something else also I wanted to mention from Levi's presentation is the idea that different countries, like you've seen in the example of East Africa,